So I chose pediatrics because I have a sister that's 10 years younger than me, and she was diagnosed with epilepsy right around 10 years old, and I thought I wanted to go to med school for the longest time. And then when she was in the hospital, I really got to see what a nurse does and what a nurse practitioner does, and I kind of just fell in love with the role. So from there, I kind of knew that I wanted to go into the role of nursing, and then the nurse practitioner role, I think, is so different from other acute pediatric nurse practitioner programs. The time and effort that your preceptors, the professors put into making sure that you get the absolute most that you can from your education to be the best nurse practitioner you can be is really what drew me to this program, was the investment that the university puts in you. I would recommend this program and this field to anyone, but you do have to work hard. But I think anyone kind of has an idea of what that's what you need to do. But I think everyone should really do their research and ask as many people as you possibly can about the program. And so I had a decent idea of what I was getting into, and luckily, again, the program does a great job of connecting you with cohorts above you so that you have the opportunity to ask specific questions about classwork, clinical experience, that stuff. But one thing I think that I knew, but it's different being in it, is again balancing the work and school and just just figuring that out. And once you get it, everybody has a little bit of a learning curve, but once you figure it out, it's fine. But it is kind of a learning curve. So the University of Michigan is obviously a very big place, but one of the other reasons that I love this program is it's actually, it's a small kind of cohort in a very big place. So there's only, I think, 8 or 7 people in my program, and all of us are so different, and it just makes the learning opportunity extremely gratifying. Everyone brings something else to the table, which professors call me to see how I'm doing. They call me when they're trying to put clinical placements together saying, hey, we found this, is this something you're interested? They really take into consideration your wants and needs and make sure that those are available for you. So they really, really care and put a ton of effort into it. It's really nice, these clinical coordinators put together your clinical placements for you. So I know a lot of other programs, you have to find your clinical placement, and especially someone who maybe doesn't have as much clinical experience, it's really hard to put your foot in the door of a good institution to get a good clinical experience. And I think at the end of the day, that's kind of the Michigan difference, is that clinical experience that they're providing you and kind of the exposure that you're getting in the hospital. So my learning experience has been absolutely amazing. I had the opportunity to go to St. Jude in Memphis, Tennessee, and I was able to work with their solid tumor neuro-oncology group, and the exposure that I got there was unbelievable. The people that I met, the doctors, the nurse practitioners, it was unbelievable, and I think that's a very unique experience that, again, if I wasn't at U of M, I wouldn't have been able to have that opportunity.